Welcome back to the KOAM Morning News. Now, if this looks like a little bit of an unusual sight, well, it's because it is. It has been probably 18 months since we've been able to welcome anybody back into the KOAM studio for an interview, and we thought the perfect way to kind of launch this back would be with a healthcare professional. And that's why we're fortunate enough to be joined this morning by Dr. Justin Ogden. Doc, thank you so much for your time. Orthopedic surgeon, and for some of you, you're going to say, wow, that's a familiar face. That's my doctor. I've been to Dr. Ogden before, but you now have a new affiliation. You still call Lamar home, but you got a new affiliation, and perhaps you're learning, and people are learning about you. Kind of tell us how that transition's been for you.
Well, I started it via Christian Pittsburgh beginning of September. It was an opportunity to be at a little larger facility, potentially implement some new technology, and also somewhat a challenge to build an orthopedic presence there. And so we're just getting started, but it's been a good transition so far.
As far as those patients that you've taken care of in the past, has it been hard to communicate with them? Hey, I'm not leaving. Like, I'm still here.
When you switch health systems, there's not necessarily a direct pipeline for communication, but you know, people have been finding me through some newspaper advertisements, social media, and so I have been taking care of a lot of my former patients. They've continued to be my patients.
I want to ask you about orthopedic care coming off of our pandemic time. A lot of people may have been in pain 2 years ago, but they were looking at possibly an orthopedic, not a surgery, maybe an orthopedic visit. They were looking at that as elective, and they did not want to put themselves in a doctor's office or a healthcare setting. As we're trying to emerge out of that, I know one of the things that I'm sure you and your staff preach are patient care and safety. What's the transition been like for you and your staff in the past 2 years?
Well, obviously at this point, you know, everybody's still getting screened before they come in, and it is admittedly, you know, being in a close contact, close quarters, seeing patients while masked has been kind of something that essentially you've gotten used to because it's went on for so long. But yeah, just trying to take precautions so that we're not part of the reason that that this spreads. But it's hopefully it's something that at some point care gets back to normal and we're not continuing to deal with it.
You know, it's so interesting during that time of the pandemic because we heard about people getting out and riding bikes more. We heard about an increase in bike crashes. We had everybody working from home. Well, carpal tunnel. That's going to build if you're sitting behind a keyboard for that long and not giving yourself proper exercise time. Has there been anything in particular that sticks out in your practice from general orthopedics that you've been like, wow, there seems to be an uptick in this?
I don't know that there's been anything in particular that you could peg to this.
Is it playing catch up though? Do you think, people are playing catch up?
Yes, I think there is some of that where obviously people have not wanted to seek out care because they either don't want to be out in public or they don't want to go through the screening. And so yeah, you're seeing people that say, hey, I've been dealing with this for 12 to 18 months, which is kind of unusual when, you know, I mean, the access and the care is normally there, but definitely some delays. And obviously in orthopedics compared to other things, the delays aren't, it's more of a nuisance sort of thing than some of the other delays.
One more thing before I let you go, because I know you're a busy man with a schedule and patients to take care of, so this is kind of where I squeeze in a little personal question. Sports injuries, sports medicine. What are some of the things that we can do as parents? Sometimes accidents happen on a court, a field. Sometimes those things happen. Is there anything that you stress to parents as far as being able to maintain your child's health and try to keep them as healthy as can be before we run into one of those accidents and need to call you?
I think it's critical that kids that are involved in athletics are also involved in the conditioning programs. Most schools at this point have some sort of conditioning program emphasizing stretching, weights, you know, aerobic conditioning. Anything where they're prepared ahead of time is obviously going to decrease injury later in the season.
There you go, kids. You don't skip leg day and you don't skip cardio day. Dr. Justin Ogden just told you that no, it's not allowed. How do we get in touch with you, Doc?
You can find me at Via Christi. Our orthopedic office is currently in the main hospital, and happy to take care of any general orthopedic issue.
Once again, Dr. Justin Ogden. Hey, thanks for bringing us back to a little bit more normal show, man.
You're welcome.
I appreciate it. Hey, it's great to meet you.
Nice to meet you.
Once again, we'll be back with more KOAM Morning News right after this.
Please give